Hello, and welcome to the Early Childhood Health Consultation June webinar titled Little Teeth, Big Smiles, Nurturing Oral Health in Children. If you're interested in Spanish interpretation during today's webinar, please select the interpretation globe icon from the menu bar and select Spanish from the list. My name is Maria Morgan, and I am the Assistant Director with Early Childhood Health Consultation. Our team is so excited for you to be joining the webinar today. Our program is in partnership with the Wisconsin Department of Children and Families, housed at University of Wisconsin-Madison School of Human Ecology, and funded by the Preschool Development Grant. Our program's mission is centrally focused on supporting Wisconsin early childhood education providers and helping support their health and safety practices. Our program envisions a sustainable and statewide model working through health consultation and centrally focused on promoting health and safety for children across Wisconsin. The Early Childhood Health Consultation Program acknowledges the American Indian tribal nations across Wisconsin and commits to a partnership to offer tailored support and best meet the needs of each tribal community. Our program offers general guidance on best practices for health and well-being in early childhood settings. Any questions about a specific child should be directed to that child's primary care medical home. In today's webinar, we will get started with introduction of the session, have central content by our guest speaker, time for question and answer, and a few closing remarks. If you're interested in continuing education credit with the Wisconsin Registry, please stay tuned to the end of today's live webinar session, where we will include a post-webinar survey link in the Zoom chat. Also, all registered attendees can expect an email within a week following the event that includes links to the webinar recording, slides, and resources. We have a couple features available in our Zoom webinar session today. Feel free to utilize the chat. You can use the drop-down selection to send your message to the hosts and panelists or to everyone. And we also have the Q&A feature available. Feel free to send your question throughout today's session, and you can use the checkbox to send it anonymously. If you're interested in Spanish interpretation, select the interpretation globe from the menu bar and select Spanish from the list. You can also mute the original audio to only hear the interpretation. And with that, I will turn it over to our program director, Dr. Dipesh Nazvaria, to tell us a little bit more about today's learning objectives.
Good afternoon, everyone. It's a delight to be on here with you again. I'm really looking forward to today's presentation. I'll tell you that in both PA school and medical school, we got very little about oral health, and I ended up having to learn a lot through conference presentations and other workshops to be able to figure out how I could best advise parents and families on how to ensure that their children's teeth remained healthy and really think about their lifelong course. So we'll be talking a bit today about those disparities in oral health that you probably see in a fair number of your settings. We'll strengthen your knowledge about the role you can play, give you some knowledge and ways to be able to address all of this. And of course, we are very willing to help you if you have more questions after today's webinar as well. So with that, I'd like to turn it over to today's presenter, Jenna Linden, who will walk us through a lot of wonderful information about oral health. I also have resisted the urge to make lots of teeth and mouth related puns, like how we can take a bite into this topic.
Thank you for that kind welcome. So hello, my name is Jenna Linden, and I'm going to actually start us off with a video that I think highlights a few really important concepts that you'll see throughout this presentation and our time together today.
Diamante Driver was a 12-year-old Maryland child who died from lack of dental care. He had a toothache. His brother had also dental problems, but he complained more, and Diamante didn't complain. At that time, his mother was having issues with housing, and they had the support of a lawyer, of an organization working with them to find housing and to find a dentist. And not even with a lawyer, they were able to find a dentist. So the child got his toothache got very serious, and he had to have brain surgery because the infection spread to the brain. Unfortunately, he died. He died after the brain surgery. And the news, this information was picked up by Mary Otto, a journalist from the Washington Post at the time, and she published the news. And Congressman Cummings saw it, and they said, this is unacceptable. So he called the state health department and immediately started reorganizing oral health in Maryland, because that was unacceptable that a Maryland child, or any child for that matter, would die from a toothache. So
that's a hard story to hear, Diamante's story, but I think it sheds light on three valuable concepts. So one, that oral health is connected to overall health. It sheds light on the importance of early prevention and intervention to receive oral health treatment. And it also highlights how many people encounter barriers to dental care. So we already covered in the introduction what we will touch on today. So I'm going to breeze through this slide and get right into the content. So the organization I work for is called the Children's Health Alliance of Wisconsin. We're a nonprofit children's health advocacy organization. Work across various initiatives. You can see them listed here. We've also recently started a food security initiative as well. And I have the honor of leading our oral health team. I'm a dental hygienist by trade. So to help lay the foundation of why oral health is important, I want to share a little bit more about the disparities that exist in Wisconsin and from a national level. So when we look at our Head Start data, 1 in every 2, so half of our Head Start children by age 5 already have had tooth decay. When you look nationally, we rank pretty low in comparison to other states on access to dental care for children at number 43. When we look at available dental professionals throughout the state, all but 10 of our counties are considered dental professional shortage areas, meaning that there are not enough dental providers in those counties to meet the needs of the populations that live there. We also see high utilization of the emergency room to try to address dental needs and preventable dental caries or cavities. So in 2021, there were about 20,000 emergency room visits for dental pain, and often patients don't receive definitive care in that setting. They might receive antibiotics and a painkiller, but it doesn't resolve the actual issue. Looking at some of the Medicaid data, when we look at youth, so ages 1 to 20, only about 1/3 of that age group who are eligible to receive Medicaid-funded dental prevention services or preventive cleaning and other preventive dental services actually receive them. And it's also interesting to look at the differences in access to medical care versus dental care. So in 2021, if we look at younger kids, so ages 0 to 5, that are enrolled in Medicaid, about 70,000 of them received care from their physician, but not from a dentist or didn't have a dental visit. So we know on the forefront that decay or cavities or caries, you could use any of those words interchangeably, that they can cause pain, right? But they also have a broader ripple effect. And you can see that ripple effect demonstrated here within each of these circles. So it can impact things like speech and sleep and nutrition and ultimately school performance and quality of life, and can impact social interactions with peers. So it goes so much further beyond just that initial pain of a cavity. I think this visualization is helpful when we think about that concept of there's tooth decay, but there's also the connection of oral health to the entire body and overall health. And this just exemplifies that concept and that body of evidence that is growing, showing the connection across oral health and overall health. So this picture shows cranial nerves that go from your brain right directly to your teeth. And it's not actually showing the ones that go to your tongue and your nasal and your oral airways. So it's even more complex than this picture highlights, but it gives a good example of those connections. And I think also highlights how it takes more than just dental professionals to address dental disease. We also need other partners like yourselves, like medical providers and other community partners across Wisconsin. So we talked a little bit about the disparities, some of the challenges that people in Wisconsin across the nation encounter when accessing dental care, and some of the programs that our organization at the Children's Health Alliance invests in to help address these challenges are seen on the screen. So one is our school-based dental sealant program. This is all across Wisconsin. It serves approximately 1,000 schools and about 80,000 children per year and provides dental prevention right on site within the schools. Secondly, we have a Wisconsin Oral Health Coalition and a Milwaukee Oral Health Coalition. These coalitions consist of oral health advocates across the state that help to invest in policy change to support increased access to dental care, as well as other efforts that move us towards better oral health for Wisconsinites. And then lastly, we also have a medical dental integration project, which integrates dental hygienists right into primary care medical teams to see children and pregnant women during their existing medical appointments to provide prevention early on, right when those first teeth are erupting and throughout the lifespan. It's a little bit about what we do, and I thought it would be helpful to equip all of you with some key oral health messages that you can use within your roles and to share with your the children that you work with and with their families as well. So let's dive into the messages. So number one, limit sugar to prevent tooth decay. So we know that sugar is a contributing factor to cavities. And here's an example. You can see back on this molar here what a cavity looks like. How do they actually form? So there's a bit of a formula to it. It begins with bacteria that cause cavities, and one of the types of bacteria is Streptococcus mutans. You can see that pictured here in this first picture. And when you add sugar to the oral environment or to the mouth, that sugar is consumed by the bacteria and the waste produced acid. And when that acid hits the tooth for a prolonged amount of time, it begins to break down that tooth, the hard enamel, the outer layer of the tooth. And you can see this white band here in this last picture. That's the weakening of the tooth, kind of the start of a cavity. You can see then in the next one here that brown hole is where the tooth actually turned into a cavity and cavitated into a hole. That's the basic formula that it takes to make a cavity. And I will note that the sugar could be also a carbohydrate, like often crackers or pretzels or cookies can be a culprit too, not just what you might think of when you think of the word sugar. So one important concept in this space is that eating and drinking frequency matters. So not just what you're eating, but when and how you're eating that. So a good way to explain this is thinking of the two cookie example. So say you have 2 cookies and you just finish your lunch and you eat the 2 cookies in that same sitting and you're done with it. That would cause about a 20 to 40 minute acid attack on your teeth or acidic environment in your mouth. Now, if you instead ate 1 cookie and then waited an hour and ate another cookie, an hour later, that would cause 2 periods of acid or an acidic environment in your mouth for 20 to 40 minutes each time. So eating frequent snacks or this could also be from drinks throughout the day creates more of an acidic environment for more time throughout the day, thus leading to your risk for cavities. So a couple of tips around eating, especially around, and drinking, especially around the bedtime routine, is to avoid putting children to bed with anything other than water in a bottle, or even just drinking something before bed, but that should be water always. Your mouth doesn't cleanse itself as well when you're sleeping. It's drier, you're not speaking and eating where it has more saliva flow and kind of self-cleanses. It gets a little bit drier. So if you're adding, say, milk to that environment and the child then sleeps, that can really wreak havoc on the mouth over time, on the teeth over time. Another important routine is to clean the child's teeth after the last feeding before they sleep. So when you think back to that formula we just talked through, if you remove one of those pieces, say you're removing the bacteria by brushing or cleaning the child's teeth, that helps to lessen the chance of cavities forming. You can also use, besides a toothbrush, you can use a small or a wet, warm washcloth to be able to wipe the gums, even if there aren't teeth present yet. And you may be familiar with some of the other bedtime routines that can be helpful for children. One of those, as an example, is the brush book bed program. So fruit juice, we get a lot of questions. I get a lot of questions as a hygienist about fruit juice, especially in working with young children. And actually, Dr. Nafzari has shared a good concept in this space around fruit juice and said, juice was meant to be eaten as part of the whole fruit, not separate from it, which I think is a really good way of explaining this. So if there is going to be juice consumption, if they're under 1, we say not at all, 0 juice under 1. For the ages 1 to 3, if they're going to have juice, no more than 3 ounces, and always keep that with the meal, kind of going back to that frequency concept we talked about. 4 to 6 years old, no more than 4 to 6 ounces with a meal, always 100% juice. Ideally, it would be a regular cup without a lid, and I'll explain why in a little bit. And then, as I said, as we kicked off this slide, whole fruit is the healthiest choice and healthier than fruit juice. A couple other tips just around diet are trying to not make sweet treats everyday foods, keeping them as special occasion foods. If obviously water is the best choice, but water and milk without flavoring, ideally, and then to avoid offering food as rewards and thinking of other replacements you could use that concept. All right, message number 2, drink water throughout the day. I think we all know the value of water. There's so many benefits to it. Our bodies are made up of so much of it, but it does help to move nutrients through the body, rids the body of waste, can promote healthy weight, and it contributes to the strength of your teeth and keeping the mouth clean. One of the mantras I like to use with my own children is water after sugar, water after sugar. So if they do consume, a fermentable carbohydrate or some sort of sugar, being able to rinse the mouth with water if you're not able to brush, within a certain time frame, that can be really helpful to kind of rebuffer the acid in the mouth and decrease that acidic environment. It also can help to fight dry mouth. Obviously, there's no sugar in it, and often public water supplies are fluoridated. In Wisconsin, about 84% of the population served by public water systems have access to fluoridated water. And some of the benefits of that fluoride are that it makes teeth strong and more resistant to acid. It can stop early tooth decay. We saw on that picture in the formula of how a cavity forms, that white spot, that white kind of band that was starting to decay. Fluoride can help to reverse that. and it interferes with the bacteria's ability to make the acid as well. So sippy cups, ideally, as soon as a child can learn to use a regular cup, that would be best. And it goes along with that frequency concept. So think back to when we just had soda in cans. You basically drank that in one setting because it would lose carbonation. Then when we started to add the bottles of soda with caps, that made soda a lot more sippable and kind of able to be drank throughout the day. And that contributed to the contributes to cavities in the acid or acidic environment in your mouth. So same concept with sippy cups. Ideally, if there was something besides water, it would be in a cup with a meal. And then anything that's portable, like a sippy cup that a child could walk around with, would only include water. There's so many ways to make it fun. In regards to the second bullet where it says flavor it, I put a water recipe card link at the bottom, and that actually is for whole fruit. So not like a sugared flavor, but whole fruit kind of infused water. So there's some fun recipes there that I've used with different children I've worked with throughout my role and with my own kids, where they can eat the whole fruit and they just kind of enjoy the fun of having it in their water as well. You know, even icing it, making it available as much as possible, modeling it yourself and drinking it in front of kids. There's also a great series on YouTube called Potter the Otter, who promotes drinking water with some of his other animal friends and is a really child-friendly video you could utilize with the children that you work with. So message number 3, brush with fluoride toothpaste 2 times a day. We talked a little bit about the benefits of fluoride already and how it strengthens your teeth. I always recommend a soft bristle toothbrush. There's a lot of different handles available for kids that are still, learning to work with their hands and improving their dexterity. There's some like loop ones where they can hold it more easily, or fatter handles. So those are fun to explore and use. We recommend circular motion, and that the bristles of the brush go both on your gums and your teeth, even maybe angling it up towards the gums on the top and down towards the gums on the bottom teeth, to make sure you're removing plaque from right in between the teeth and gums where it likes to hang out. And then as far as flossing goes, typically kids need help flossing up until the time when they can learn to tie their shoes, which is kind of a good indication that they might be ready to learn to floss more independently. I often get the question, how much toothpaste should I use? And these are the 2 recommendations. So for under age 3, we just say a rice-sized amount of toothpaste, which is very little. It's almost just like dipping the bristles into the toothpaste tube. And then for 3 to 6-year-olds, a pea-sized amount. Couple of toothbrushing tips that you can utilize both at home and with the children that you work with. You can see the different positions listed in these pictures. So one with a parent or guardian or caregiver sitting on the chair with a child between your knees, on your lap, or you can sit on the ground with them and have them lean back into you. It's kind of counterintuitive, but it is a lot easier to brush a child's teeth from that behind position, which doesn't always come naturally when you're thinking about what would be easiest in brushing children's teeth. There's also some wonderful videos and examples of toothbrushing in the classroom and toothbrushing programs for students or daycares. And I'll provide a link at the end that shows videos and steps on how to do that in a classroom setting or a daycare setting if it's something you're interested in. Kind of walks through how you would teach a child to brush the different parts and sides of their teeth. Method number 4 is to get a dental visit at age 1. And this can be challenging for many reasons. Sometimes it's difficult to find dental providers that'll see a child at age 1. They might say, you might call and ask, and they might say, oh, we see them at 3 or 4. So that's not uncommon to encounter that. So I encourage you to look at some of these alternate options for getting early dental care, whether it be a school-based program or working with The medical dental integration model I shared, where the child might see a dental provider during the medical visit, or even there's many medical providers that are beginning to do dental screenings and fluoride varnish as a medical provider during child well visits as well. So there's some other alternative options if you're not able to find a dentist locally that would see a child that young. The question often comes up of why do baby teeth matter? They have some crucial roles in development, and that they support eating and chewing and speech and overall health. They promote self-esteem, and they do hold a spot for those adult teeth that are growing underneath the baby teeth. And if they have untreated decay, along with the other ripple effects that we talked about from tooth decay, they also that decay can damage the developing tooth underneath that baby tooth. Just a quick overview of what that first dental visit looks like. It's really simple and quick. The time with the doctor or the hygienist is actually in the mouth is very minimal. I would say often it's a minute or less. And they're really checking for early warning signs, any red flags, making sure things look within normal limits, talking with a parent or caregiver on what's the protective habits that you have that are helping encourage oral health and what might be some risk factors, talking about home care routines, and really it's very prevention focused. And also it's just good exposure to the concept of going to the dentist to help reduce fears over time. And if a child can have a positive experience from the get-go without tooth decay, that helps to build that confidence and reduce fear. And then last message from the 5 oral health key messages is that oral health is important during pregnancy. So this might not seem directly related to the child, but in many ways it is. And let me explain myself a little bit further. So when a child is born, they're not born with a bacteria that causes tooth decay. Instead, it's often passed on from someone who spends a lot of time with the child. So it could be a caregiver, a mom, a dad, someone that the child spends much time with and does normal things with that adult, like whether it be kissing the child or, maybe cleaning off a pacifier with your mouth, or sharing a spoon as the child begins to eat. So all of those kind of normal activities can pass the bacteria that causes cavities onto a child and introduce it to their mouth. There's also a lot of research and a growing body of evidence looking at the connections between the mother's oral health and pregnancy. So possible connections between poor oral health of the mother and preterm low birth weight babies. That's being researched currently. And then another misconception is that it's not safe to receive dental care during pregnancy, which is not true. It actually is safe and important both for the mother and for that child once they're born, that mom have as healthy a mouth as possible before delivery. So as we wrap up, I just wanted to share a few additional resources that I think could be helpful for you in your roles, and really just remembering that overall concept that teeth have really important jobs in the lives of our children. And the earlier that we can invest in dental prevention, that really sets a child up for a lifetime of oral health and in quality of life. So the first resource I'll share is from Head Start, National Office of Head Start. And if you were to search oral health on that website, they have loads of tools that you can put to use within your roles, including parent and family-facing materials on oral health, like leadership or teacher or daycare staff resources that are more like staff-facing, and really any concept you can think of that might come up with kids and oral health. They have a publication, and they're usually really simple one-pagers, easy to understand, and are evidence-based and updated frequently as any evidence changes. So that's one resource that I highly recommend. On our website, we have resources about our school-based program that I mentioned, about medical dental integration model, and about our Oral Health Coalition. And that Oral Health Coalition is open to anyone, whether you're a dental provider or just an oral health advocate, or want to learn more, want to be in the know with webinars that we might offer. Anything within that space, you're welcome to join. It's a simple survey to be able to join the coalition. And then I will let the team share more about their specific resources, since they're the experts in that. And then with that, I will pause and see if we have any questions.
Jenna, thank you so much for that walk through the world of oral health and how we can think about tooth decay and particularly the factors that make a difference. I think most of our early childhood educators, of course, are not they're not there for every toothbrushing in a child's day and all, but I think recognizing how some of the behaviors that start early in childhood, including habits around frequent snacking and things like that, and also questions they might be asked by parents are really important things that you covered here. Let me invite our audience to please, if there are questions that are on their mind, big or small, about oral health, please either put them in the chat or please use the Q&A feature, which is the button on the bottom of your screen, to be able to ask a question. Either way works. We have eyes on both of them. And while people are thinking about questions, well, actually, I see one already. So let me give voice to this one. What are your recommendations on talking to parents who are told by their pediatrician to give child juice when the parent is concerned about gas or constipation?
That can be tricky when there's some kind of conflicting messages that might help with one thing, but then hurt a different area of health, right? So that's a great question. I think you could follow the concepts that we touched on a little bit during this presentation, in that ideally, if they were to have juice, it would be contained to that setting of a meal and not sipped on throughout the day. That's huge. That's really, really can make a significant difference. And then the before bed concepts as well. So that the teeth are clean when they fall asleep, that there's only water after that last cleaning. And that will set the child up for success as far as keeping the teeth healthy, even with, somewhat of a small contribution of juice throughout their diet during the day.
Yeah, and I'll add in from the pediatrician side of things, juice may be an option. First of all, I hope no child is constipated for so long that they're getting juice to quote unquote address the constipation for very long periods of time. And if there is a situation that does require long-term treatment of constipation, we have much better options that don't involve sugar. I would say that we have other ways to address this situation that would not impact oral health in the same way. Other questions, please, in the chat or the Q&A. I will offer a brief anecdote here, which actually stems off of one of the things that you mentioned, which is about the cleaning the teeth before bedtime. I once had to see a 3-year-old to do a pre-sedation clearance. He was going to have extensive dental work, tons of cavities, et cetera, et cetera. And he was going to need sedation, a lot of teeth needing to be pulled and a lot of fillings and so on. And while in the process of that, I thought, well, let me discuss with his mother. I did not know this family before, about how can we avoid this happening again with his remaining teeth and so on. And what we found was, she said, well, he only brushes his teeth once a day, and it was in the morning, not at night. And I said, okay, well, evening is more important, before bed, et cetera, et cetera. And and Mom said, well, I'm not home in the evenings. I said, oh, okay, well, who is home? This is only a 3-year-old. And she said, well, I work second shift, so I'm not home. His 13 and 15-year-old older brothers are who care for him. Right. And then it became apparent, right? She knew that that he needed his teeth brushed twice a day, but the significant circumstances in their lives made it really hard. And no teenager wants to police their 3-year-old younger brother around toothbrushing, right? So it was a challenging situation. I don't have a clear and great answer to it, but I think if we see issues like significant cavities, right, it helps us to think about the larger context that families are in, and
Mhm.
recognize that sometimes they're trying the best that they can and can't necessarily um, address things there. So I see a
Mhm.
slew of questions coming in, so I'll maybe transition over to some of those. So one question is, if baby teeth have cavities, in general, do you fix them or just wait for them to fall out? They said that a mom told them that, that you just wait for them to fall out, and they didn't think that was true. What's your experience
Yeah,
there?
great question. I think that does sometimes come up, and I think it is a misconception that you can just let them fall out because they're baby teeth. But going back to a couple of the points we touched on, they do play a really important role in the fact that they hold a place for adult teeth. They hold that spacing, so there's enough room for your adult teeth to grow in. So we don't want badly decayed teeth remaining in the mouth. Um, they the infection can spread, like we heard with Diamante, that your teeth and your palate and your brain is not far beyond that same location within your body. So being cognizant of the fact that there can be further repercussions as that decay or that cavity progresses. And then that there is an adult tooth growing underneath there too that you don't want the decay to damage as well. So there's many reasons why it's important and beneficial to have those teeth treated. There are some more like minimally invasive approaches that are becoming more prevalent too, like a silver diamine fluoride product that can help to stop the cavity from progressing any further. And then sometimes that's utilized as the child gets comfortable with dental care. And then when they're older, they might have it filled when they're able to cooperate in that sense. So definitely address the decay in baby teeth.
Yeah, and I want to highlight for everyone that dental access is challenging, as we covered in this presentation. Do remember that that children's primary care providers can and should play a role in oral health assessment, given that we see children so often in those early years of life. And fluoride varnish is incredibly easy to apply. I tell medical students I can teach you how to apply fluoride varnish in like 2 minutes. This is
Yes.
not an advanced skill, and it's really cheap and inexpensive to do. And it doesn't replace dental care, but if you don't have options, it's a great thing to be able to do.
Absolutely.
Let's see. Another question we have here is, do those pink tabs for seeing people how good they brush help with kids? I remember this when I was young. And is there any place we can get them for use? And then there's also a question about is there any program that helps finance toothbrush or toothpaste for child care centers? So let's start with the pink tabs. I haven't seen those in a long time now. Is there a reason for that?
They do still exist.
Yeah.
I actually just got asked about them recently by by a Head Start teacher because I think it's such a fun visual, and I do think it is a really good, obvious visual of okay, this is where there's germs on my teeth, and this is where I need to brush, and I need to make sure I'm getting all these spots to get it all off. So I did see them on Amazon recently. I just did a search for them, so you can look and see what's available there. You can also ask your dentist because a lot of times dental offices have them on hand. If there's like one child that wants to use it for, a week to be able to amp up their brushing skills, you could check with your dental office too.
Okay. Yeah, I feel like they're just not standard anymore. So good to know they're still out there. Yeah.
Yes.
And what about toothbrush or toothpaste supplies? If a childcare center says, hey, we think families sometimes just may need a brand new toothbrush or may need some appropriate toothpaste.
I mean, I would start with your local community and see if there's dental offices willing to donate. I've often found that to be the case. I'm also for Wisconsin, and every state has someone that's called a dental hygienist liaison. They are a hygienist that works with Head Start programs to help just promote oral health within Head Start families. And so sometimes we can help make connections on like, hey, there's a grant for tooth toothpaste and toothbrushes that you can use for, 0 to 5-year-olds, and we have some potential resources there. So I think just asking locally first is really a really good starting point, and seeing where that leads.
Mhm. Yeah, and I don't know this, but I wouldn't be surprised if in at least some dental offices that the free toothbrushes and toothpaste that they offer you at the end of visits may actually be like things that the companies send them, right? Like they're not buying them themselves. So calling them and saying, "Hey, do you have 20 tubes of toothpaste I can use for this purpose?" They'd probably be like, "Yeah, sure, come on down."
Right. Yeah, I do think that is the case. Sometimes that's just kind of an add-on to what else they've purchased within their dental office. They get that at
Yeah.
either free or very minimal costs.
Sure. Another question is, there's a whole slew of them coming in. What are some behaviors or signs that a child may be experiencing oral health problems?
That's a great question. And I think it can look different ways for different kids, but and also I will add that I'm shocked sometimes that they aren't complaining of more pain when I see the extent to which their teeth are decayed, because I think they learn to live with that pain sometimes. But definitely it can impact diet and eating. I had a story from a teacher in a daycare who was telling me the child loved apples, and every time he tried to eat them, he just complained of so much pain. And when she looked in his mouth, it looked like little black dots where the teeth were, and they were really decayed down to the gum line, and he wasn't able to eat. And it was impacting his behavior significantly too. They kept having behavioral issues, but really it was tied back to the tooth pain and
Mhm.
the long longevity of having it for so many months. So behavior, yeah, not sleeping, um, complaining. Like I always ask a child first, like, does anything hurt in your mouth? Because often if you ask that question directly, they might disclose that to you, and you just weren't realizing that that the mouth was the source of the pain.
Yeah, it reminds me kind of like when kids can't see well, and to them this is normal. And then when the first time you put, you know, give them glasses, and it's like, I didn't realize the world could be so clear. I think
Mm-hmm.
you'd think pain that they'd complain, but sometimes it's like if this is constant, then it's like, why mention it because it's always there, right? So I think
Mm-hmm.
question, looking for behavior changes, difficulty eating or chewing compared to other kids would all be pretty significant there.
Mm-hmm.
Yeah, another question is, can we brush our children's teeth in childcare after lunch?
Yes. I mean, I don't know what your policies are, but I have seen that in many childcare settings, depending on what your opportunities are there. But um, often I do see that they'll brush after they finish that afternoon meal. Um, and that way, like you said, sometimes parents' schedules don't allow that
Mhm.
brushing to happen as frequently at home. So I think it's a really good opportunity. And I noticed in the different school-based programs I've helped with in schools, sometimes that is the one time they have their teeth brushed during the day is because it's happening in the school setting. So I think that's significant to mention.
Yeah, and I don't think there's any restriction that would prevent it. It's not a medical procedure or anything like that. So
Yeah, yeah.
and
Yeah, if you look on that first website I listed on the slides, that has some really good like step-by-step, here's how you can do this and follow, infection control protocols and make it really feasible and quick and easy in the classroom. So,
indeed. Yeah, because certainly making sure that the, right child is with the right toothbrush and things like that.
yes,
All the usual things. Yeah.
absolutely.
Do you recommend electric toothbrushes?
I think if you're able to have one, yes, but I also am not opposed to the manual toothbrush. I think if you know how to brush and to get all the right surfaces of your teeth, and you've kind of learned the basics of that, I think you can be just as effective with a um, a manual toothbrush. Now, sometimes if a child has difficulty with dexterity, or maybe there's some special healthcare needs that come into play, and they have a harder time with effective removal of plaque and that motion that they need to do with brushing. Then I think that's where those can be helpful. Electric toothbrushes can be helpful to like cause a little bit more of that mechanical removal of plaque on the teeth.
Mhm.
So
Yeah,
I'm a proponent of either.
sure. Probably, I think it's fair to say any toothbrush is better than no
Yes, just
toothbrush.
brush.
These are great questions, folks. Keep them coming. There's another great one here. asking about long-term pacifier use, and at least from an oral health perspective, what age is it recommended not to use them? And good way to work with families around, hey, maybe this is something we should ease them off of. And they comment that we have several parents who use the round pacifiers, and we already notice crooked teeth. We work with 1 to 2-year-olds, and we try to limit pacifier use to only nap time while at the center.
Yeah, I think that's a good recommendation. And that's something I did as a parent as well, and that I recommend to patients. And now, orthodontists may have a different opinion, so I don't want to speak for them on this, but I usually say to try to kick the habit, by like 2 or early 2s. And I did notice, like, even in my own children, like as I removed the pacifier and we like limited it to just bedtime, and then eventually were able to get rid of it, that their teeth even shifted to a better formation after we removed that, between the ages of like 2 and 6, as they were beginning to lose baby teeth and whatnot. So you could see a difference when they stopped using the pacifiers frequently.
Yeah, yeah. I think, and it's interesting because children are very different. My own 2 children, who are now 20 and 21, and will be highly embarrassed that I'm discussing their pacifier use habits, but tough. My son never used a pacifier, just spat it out the couple of times we offered it as an infant and never needed one. My daughter loved hers, and we had to take explicit action to move it along as a toddler. And I think I've heard from the orthodontist that they don't necessarily see huge issues with crooked teeth from pacifier use that are permanent or cause long-term issues. But I do think there's also the practical aspect of, right, pacifiers fall on the ground, cleaning them. What if there's a favorite pacifier and it gets lost? And I think a good question to ask, and this goes beyond the world of oral health, is what need is this serving for this child, right? Often it's habit, right? I need this in order to fall asleep, and so on. So how can we maybe ease them away from that so that they're not needing that, and then you don't end up with these other behavioral crises that are related to it that aren't even directly about the health of the mouth.
Mm-hmm.
Yeah. All right. Other questions, and I do want to see if there's anyone in the Spanish channel that might have questions. Please know that our interpreter would be able to help us with that. While we're just waiting to see if there's further questions, I also feel like there's been a change over the years that maybe some of our providers have noticed, which is about we used to, in communities where water was not fluoridated, we used to prescribe fluoride supplements a fair amount, and that still may happen. But I think for many families that was also kind of a pain, right? Remembering to get it filled and a daily supplement and whatnot. And it feels like often we've moved to fluoride varnish as a less frequent but still durable alternative. Has that been your observation as well?
Yeah, I've seen some of both. I've seen some in non-fluoridated communities where they still prescribe drops, but I've also seen an increase in fluoride varnish, like you said, both in the dental but in the medical setting too, which I think is an important it's such an important opportunity to leverage to introduce early dental care and early dental prevention. So I think that makes a difference. And we still promote community water fluoridation because it's one of the easiest ways to get to reach a large population. It's inexpensive, it's safe and effective, and has been researched for 75 years. So I think that's another tried and true approach that we still support.
Indeed. Do you have any, I'm looking back at questions, there's a couple here. Do you have any good strategies for addressing long-term pacifier use with parents?
That's a great question. And I think going back to what you said, it can sometimes be child specific, right? As far as why they're using it and what motivates them to get rid of it. So I think lessening the frequency of it throughout the day, as like I feel like they almost don't even notice it's in their mouth sometimes because they're so used to just having it there, right? When they're just so used to having that for multiple years. And so I don't know, strategies that worked for my children or with other kids that I know have been, like you said, limiting it to bedtime or nap time, passing it on to someone else, like another child, like not actually, but conceptually passing it on to a younger cousin or a younger friend, or I don't know. I've seen people put them inside teddy bears, like Build-A-Bears. I've seen so many different approaches that people have used to try to kind of break the bond.
I will say, and again, this is one example. It doesn't work for
Yeah.
every family. With my own daughter, I said to her, okay, this is your last night using the pacifier to go to sleep. Tomorrow, no more pacifier. And the next night she looked at me and was like, where's my pacifier? And I said, nope, we're done. And she cried for a while and then she fell asleep. And the next night she was fine. I think she realized she could do it.
You do it.
So there you go. But every family and every child is different. And I think the question is more, how do you get the parents on board, right? It's not even so much the child, right? But the parents are feeling like, well, are you judging me? Or are you saying there's something wrong with my child? I did have a wife of an old friend who I was visiting them who said it's okay that my 3 and 4-year-old still have juice in a bottle right at bedtime. There's nothing really wrong with that, right? And I was like, oh, I really don't want to get into the middle of this fight. But I couldn't agree with her,
Right. Right.
There's a comment about a inventive technique. The pacifier fairy came and picked up the pacifiers and left other gifts. So
I'm sure the audience could share lots of good approaches with us too, right?
yeah, sure. To a certain extent, I mean, I'll just say like, if parents are not bought into stopping pacifier use, there's only so much you can do at that point. I do see a question in Spanish, and I'll give our interpreter a moment to help us with that.
If it's not working, the translation, I think it says it does for small kids, can they use toothpaste or just brush with toothpaste or just water?
That's what I was thinking too, but
Okay. Yeah.
yeah.
And correct me if I'm wrong, John. Please, it happen. So it depends with the amount of toothpaste I mentioned, like with that rice size amount for the under 3 and the pea size amount for 3 to 6, that I recommend fluoridated if the child has any risk factors that might be contributing to cavities or the cavity process. And bearing in mind that they will likely swallow it when they're young. So that's why you use such a tiny amount, keeping that in mind. If they have a very healthy mouth and you're not seeing any risk factors or early signs of tooth decay, it is okay to brush with water. You're still just wanting to mechanically remove the bacteria that's in the mouth and the plaque. And that can be accomplished with water and a toothbrush too. But going back to what I initially said, it is okay to use that tiny amount of toothpaste to help begin to incorporate fluoride early on in life and just use that as a prevention measure. And I would stick to those small amounts of toothpaste for that reason, because they will often swallow it.
Yeah, and I do want to highlight that a small amount of toothpaste swallowing is perfectly fine. It's not toxic or anything like that. I think it's more if it's happening in large quantities and on a regular basis that we may have some concerns.
Right.
Great. I just see another comment here. One parent trimmed the pacifier with scissors nightly until the child didn't like it and threw it away themselves.
I've heard that before too. Thanks for sharing.
There we go. Wonderful. All right. I'm not seeing any other questions at this time. I'm seeing I saw one comment that that was of appreciation. Thank you so much for spending time with us, for answering all these questions, helping people understand what's going on with oral health. It's really a delight. And I'll let Maria close us out here.
Thank you.
Great. Well, and thanks everyone for your engagement in the Q&A. It's lots of exciting thoughts and questions. So as we wrap up our time together, the Early Childhood Health Consultation Program would just like to recap the various services that are available. In addition to webinar trainings such as this one, we also have a podcast with monthly episodes. The podcast is called Teachers, Toddlers, and Tissues, and feel free to explore that wherever you listen to your podcasts, or you can check it out on our website. Also on our website is our resource library, which is a collection of both print and video resources. In addition, we have health consultation services with a growing number of locations across the state of Wisconsin and a goal of statewide support. And just a reminder, all of these services are completely free. As you see the state slowly expanding that purple color, we're excited to announce our expansion of our health consultation service location, now supporting almost 4,000 active early childhood providers with the goal of statewide support. If you're interested in learning more about these specific locations, feel free to go to our website for more details. You can also check out our previous collection of podcast episodes. There are 15 readily available to listen in, and you can also subscribe using your favorite platform or go to our website for more information. We invite you to save the date for future webinars. You can go to our events page to see not only upcoming dates, but also registration links to future webinars. If you are interested in reaching out to our program, you can do so by phone call, text, email, on our website contact form, and you can also follow us on social media. We'd like to say a special thanks to the many early childhood education providers that offer us guidance, including our very own advisory board of early childhood professionals. We'd like to thank our colleagues from other childcare health consultation programs across the United States, our current project partners, and our past project team members. As we wrap up the webinar today, we'd like to make a few reminders. At the end of today's event, you can locate a post-webinar survey, and this is a place where you can enter your information for continuing education credit with the Wisconsin Registry, and you can also give us feedback on ways we can improve future webinars. Also, following the event, you can expect a follow-up email with a link to the recording, as well as a link to the survey just in case it's needed. Then a week following today's live webinar session, any attendance information entered in the post-webinar survey will be entered directly with the Wisconsin Registry for Continuing Education Credit. If you are watching today's webinar recording and are interested in receiving credit, we invite you to explore the continuing education log through the Wisconsin Department of Children and Families linked here on the slide. So at this time, I'd like to direct your attention to the live Zoom webinar chat. This is where you can find the post-webinar survey link and enter your information if you're interested in Registry Continuing Education Credit. You can also use the drop-down selection once you click on the link if you'd prefer to have it in Spanish. And with that, I will hand it back over to Dr. Depeche Nazaria, our program director, for some closing remarks.
Thank you. As they start mowing the lawn outside here, hopefully that noise isn't too obtrusive. Thank you so much again to Jenna for her time and talent in discussing and enlightening us all about oral health. We always say that oral health is something that is that the mouth and the brain somehow has become decoupled from talking about health in general. So we're pleased, at least in our webinar series, to talk not only about mental health and behavior, but also about oral health, and recognize that you not only see this every day and can make a difference in this, but you also talk to families a lot and can help enlighten them. Thanks for all that you do, and thanks for joining us today. We appreciate you.